Many theories had been proposed to explain how dental hypersensitivity occurs, out of which three main theories are considered the most. They are direct neural stimulation theory, fluid or hydrodynamic theory, and finally the transduction theory. Starting with the direct neural stimulation theory, it states that nerve endings inside our dental tubules are directly stimulated and cause sensitivity or pain. But the theory was not taken into consideration. Okay, so what contradicted this theory? Let's see. Even though certain nerve endings are seen inside the dental tubules, they are confined to the inner dentin and are absent in the outer dentin. Well, to support this statement, an experiment was conducted by topical application of a local anesthetic to the surface of the affected dentin. However, the result was that even the topical application of local anesthetic does not eliminate or subside the dentinal hypersensitivity. Okay, just think, if the pain was due to the direct stimulation of the nerve endings in the dental tubules, then the application of local anesthetics over it should subside or eliminate the pain, right? Okay, coming to the next theory, the transduction theory. This theory states that various stimuli stimulate the odontoblastic processes, which in turn conducts the impulse to the nerve endings located in the inner dentin. Well, the argument against this theory was that if it was this type of conduction that take place over here, then there should be the presence of neurotransmitters, since it is our neurotransmitter that act as a carrier for the signal. But over here, the neurotransmitter vesicles were not found in the odontoblastic processes, and also there were no evidence of any synaptic relationship between odontoblastic processes and the nerve endings. Hence, this theory was also rejected. Finally, the widely accepted theory, that is the fluid or hydrodynamic theory. This theory states that dentin sensitivity is due to the movement of fluid that is present inside the dental tubule. Well, inside this dental tubules, various stimuli like heat, osmotic pressure and drying can cause an outward movement of fluid, whereas cold stimulus causes an inward movement. And in both cases, that is, the movement in either direction can cause mechanical disturbance of nerve endings which are present in the inner dentin. Followed by this, the free nerve endings in the plexus of Rashkoff in the pulp sends these disturbances, resulting in sensitivity or pain. Basically, this is a widely accepted theory and proposes that nerve endings act as mechanoreceptors.